Most women, when they think about menopause, may have visions of hot flashes, painless sex, vaginal dryness, low libido, bladder leakage, and other pelvic symptoms. But many women are surprised to learn that the joint pain that they may be experiencing in their 40s and 50s and 60s may be related to menopause. Hi, my name is Dr. Brooke Kolisiak. I am a pelvic health physical therapist who is passionate about helping women navigate menopause successfully. And in today's video, we are going to talk about menopausal joint pain and what you can do about it. First, let's clear up what menopause actually is. Menopause marks the end of a woman's reproductive years. And menopause actually is the 12-month mark since a person has last had her period. And typically it occurs anywhere from age 45 to 55, with an average age of 52 years old in the United States. Now, many women are familiar with some of the most common symptoms of menopause. Change in sleep habit, change in mood, loss of libido, vaginal dryness. These are some of those most common menopausal symptoms that many people have heard of. Now, joint pain is one of those symptoms of menopause that oftentimes gets overlooked or even forgotten about as menopause potentially contributing to the joint pain. And therefore, women unfortunately can kind of get the runaround in the medical system trying to figure out what is going on with their joints that are hurting, because we're missing the big picture that it can be related to the systemic changes in the body that come from being menopausal. Did you know that more than half of menopausal women will experience joint pain? Now, what does this pain feel like? It can be, or is often described as aching, throbbing, sore, stiffness, but for some women it can kind of increase up to a stabbing, shooting, even maybe some numbness, tingling, and weakness associated with it. These joint pain symptoms can be constant, or they can kind of come and go. Most commonly, they occur at night and can disrupt sleep, but they can also occur after physical activity. The most common joint that is typically affected are the hip joints in women. Now, getting to the root cause of joint pain during menopause is a little bit tricky, but a lot of it is related to the changes in tissue that happen with the decrease in estrogen that happens with menopause. But there can be other factors that play a role in it as well, hence making the diagnosis a little bit trickier for many people. Joint pain during menopause is most commonly linked to that decrease in estrogen during this season of a woman's life. All of our joints have estrogen receptors in the joints themselves. And these estrogen receptors, when estrogen is present, help to keep inflammation low in these joints. So when estrogen starts to decline, these joints then can be inflamed, start to have swelling, and become irritated and painful. Now, estrogen is not the only hormone that can play a role in menopausal joint pain. In fact, the declining levels of testosterone that occur at this time of life also play a role. So testosterone helps to contribute to muscle mass. And when it declines, we also see a matching decline in muscle mass, which means that our muscles don't have the same strength that they used to. And if we don't do something to kind of impede this decline, our muscles are going to be weaker and have to work harder to do the same tasks that they were doing just a few years ago. And because of that, those muscles can be more prone to tendon injury and ligamentous injury, and that can cause some additional joint pain and problems. As I spoke about earlier, reaching a diagnosis of joint pain during menopause can be pretty tricky, especially if that pain is hip pain. Hip pain has many different causes, but if your hip pain coincided with that same time where menopause started, that is definitely something that is worth mentioning to your healthcare provider so that you guys can tease out exactly what's going on. One of the most common diagnoses that we see in that menopausal period with joint pain is gluteal tendinopathy. Your gluteal muscles are a group of your buttocks muscles that attach to your pelvis and to your thigh and have many different functions in that hip and pelvic area. As we just spoke about, in menopause, we can start to see a weakening of these muscles from that decrease in sex hormones. And when these muscles are weaker than they were before, but still having to do the same load, they can start to complain. Some of the most common places that women start to complain about pain is a deep ache inside the hip or a pain on that lateral side of the thigh. Sometimes women can describe that pain showing up in the very front of the hip as well. It's highly varied where it can occur, but in any of the situations, it's oftentimes debilitating as it can disrupt sleep and disrupt daily activities and ability sometimes even to get up and down from a chair without pain or as easily as you used to do before. If you are experiencing menopausal hip pain, what can you do about it? Some women find relief from their menopausal joint pain when they go on hormone replacement therapy. So this is something to definitely discuss with your medical provider to see if this is a right fit for you. Another option that can be very helpful, but is often counterintuitive to women, is to start to strengthen, stretch, and move more. Oftentimes when we're hurting, we want to move less to avoid the hurt. But when we start to move less, that actually has an even more detrimental effect because we start to get weaker, which kind of compounds the problem that we already have. So introducing the right kind of movement can be super helpful to eliminating the menopausal joint pain you're experiencing. The more you move, the more blood flow there is to the area. The more blood flow there is to the area, the greater your tissue's ability to heal becomes. But again, we want to make sure we're doing the right kind of movement so as to not aggravate the symptoms, but instead help with the symptoms. So in the case of menopausal hip pain, often a low impact strengthening program to make sure that the gluteal and other hip muscles are working as effectively as they can be, combined with some gentle stretching in the area, is the best way to start to get blood flow increasing to those tissues and get those muscles and tendons working the way that they need to in order to be pain-free. So let's talk about a few examples of some exercises that you can do to help if you are experiencing menopausal hip joint pain. Massage is one way that you can help increase some of the suppleness in the muscle and improve the blood flow to it. One way that we can massage around the hip is to use a foam roller. These you can get off of Amazon for relatively low price, but we want to roll on the side of the thigh, the front of the thigh, and the back of the thigh with the roller to help to free up any restrictions, improve blood flow to the area. Stretches that can help improve the mobility of the hip are also important. So one of my favorites is a deep squat stretch where you stand with your feet wider than your shoulders and you drop down into a deep squat. Oftentimes people have to hold on to something heavy like a doorknob or a heavy piece of furniture so that you can really relax down into that stretch and hang in that position for an extended period of time, say 30 to 60 seconds, to help get those hips to relax and move. You can even kind of sway back and forth in the position a little bit to help get that freedom of movement with the exercise. So a deep squat is helpful. In sitting, you can do a seated Piriformis stretch, and that is where you're going to sit with the ankle of one leg crossed over the knee of the other leg, and then kind of lean forward into that stretch until you feel a pull or a tension in the buttocks muscles. Tension and pulling is fine. It shouldn't be causing any increased pain, but we want to see if we can get those buttocks muscles to relax and let go some more. Another stretch that many people find the easiest to do is laying down on your back and pulling both knees up to your chest. So grabbing behind your knees and bringing them up towards your chest or shoulders as close as you can. Again, to kind of open up through the buttocks muscles and help them to relax and stretch. For each of these stretches, I'd recommend holding them for 30 to 60 seconds and then relaxing and letting go. If they're a sided stretch, do both sides. And you can do anywhere from 3 to 5 repetitions of each to help get those muscles to relax a little bit more and move a little bit more freely. Once you stretch the muscles out a little bit, it may be helpful to start doing a little bit of strengthening. So 2 of my favorite strengthening exercises are a chair squat. So a chair squat is simply where you stand in front of a chair with your feet about shoulder width apart. And then you're going to sit your butt backwards like you're sitting down in the chair, but you barely touch the chair, and then you squeeze through your butt as you stand back up. And so doing 5 to 10 repetitions of that at a time, and then doing 2 to maybe 3 sets of that at a time can be really helpful. If that seems like too much altogether, what I'd recommend is breaking that up. And anytime you go to sit down in a chair, try doing like 3 to 5 reps where you touch your butt and stand up before you actually sit all the way down. That way you're getting in that strengthening throughout the day. Now, my other favorite exercise for strengthening the hips is a TheraBand side step. So getting yourself like a loop of stretchy band and putting it around your ankles. And then what I want you to do is find an area that you've got a little bit more space to move around in, where you're going to take steps to the side and then together, step to the side and together. And you're going to do that all the way across a room and back while you're facing one direction, but you're moving side to side. And that works the side of those hip muscles. You can get TheraBand loops pretty easily, honestly, probably at Target, Walmart, or even on Amazon to be able to do that particular exercise. If you don't have those loops at home, try doing it just sidestepping right now to start to kind of get the feel for it. To recap, today we talked about one of the lesser known symptoms of menopause, and that is joint pain, and more commonly hip joint pain or gluteal tendinopathy. We focused on what causes it and what you can do about it, and gave you examples of different ways to improve the blood flow, movement of the muscles, and strength of the muscles to help eliminate that joint pain. Now, if you try these and you're still experiencing hip joint pain, I highly recommend talking to your medical provider about the issues that you're experiencing. And more specifically, it may do well to partner with a pelvic physical therapist to assess specifically what the muscles in and around your hips, pelvis, abdominal, back, and buttocks area are doing or not doing well to get to the root cause of the pain that you're experiencing. Because just because it's common that women can experience joint pain during menopause doesn't mean it's normal, and there are things you can do to make sure you're as pain-free and active as possible.
Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.